Most members of the public are familiar with Cincinnati Police Department's Special Weapons and Tactics SWAT team, the brave and highly specialized police officers who deploy in high-risk situations to keep our communities safe. Many Cincinnatians probably don't know, however, that a UC Health doctor works and trains right alongside the SWAT team to keep them safe if they are critically injured during an operation.
Law enforcement was called to their residence for some reason. Upon entering, law enforcement was injured severely. SWAT team was called to neutralize the situation of the aggressor as well as rescue the injured officer. So we would arrive in a vehicle such as the white one over there, or with the equipment truck, possibly with an armored vehicle. They would probably line up, what we call stack up, on the protected side of the vehicle and then make entry. I would be at the end of that line. And then I would peel off and usually stand outside the door in sort of a somewhat protected area to be close enough to where if one of them were injured or they needed me inside, which in this scenario, that's what the scenario is that they're on the second floor, larger patient, larger, unable to get them back down the stairs. So they then bring me inside to function inside, which is why we wear the same protective gear that they do.
This high-level tactical medical skill can only be found at the region's academic health system.
You get to see a doctor out of his normal element or her normal element, and they're very down to earth. They're very helpful. Whether it's simply something more serious, hopefully we don't ever take a shot or get seriously injured on an operation. But if we do, we know they're there to help. We know they're there to get us immediate medical attention, and they're there to ultimately save our lives if needs be.
UC Health SWAT doctors treat patients on site during operations and train officers on basic trauma medicine in the event that they would need to provide treatment themselves. Both Dr. Benoit and Dr. Calhoun have been with Cincinnati SWAT for about 10 years. Over the years, they have trained many officers and residents who work with the team. Each month, the SWAT team gathers for training around Cincinnati. A UC Health doctor is usually present at every tactical training session to practice treating patients in the field.
So the opportunity to do this sort of thing, where when they are faced with somebody who's bleeding, maybe even themselves, grabbing that tourniquet, putting the tourniquet on, recognizing which wounds you most efficiently pack versus putting a tourniquet on, versus you just can't do anything and need to prioritize that patient for getting out, is all really important. So it's stuff that fortunately is now being taught. And UC Health is teaching this through Stop the Bleed classes to every citizen around Cincinnati who wants it. We take it a couple steps up, add it in the tactics, add in a little bit more advanced training for these guys, and they're really good. I would let any of these guys, if I had a wound like this, I would more than happy to let any of these guys take care of me.
So I definitely feel safer with them present. I feel like that, outside of a very bad injury, I know they're going to keep us safe and get us to the hospital and get us the proper medical attention.
Few hospital systems in the country feature physicians who are integrated into their local SWAT teams like UC Health. Dr. Benoit, Dr. Calhoun, and the rest of UC Health SWAT physicians bring all of their expertise into dangerous, real-life scenarios.